and I will not waste any further time, and I would like to introduce the first speaker, Dr. Malini R. Kapoor, who is a professor in microbiology and in charge of BMWN and Kayakalp, BMCC and Safdarjung Hospital, Delhi. She has got more than 106 publications, in which 57 are international. And she is one of the, working as a biomedical waste IPC AMR Vice President, Indian Society of Medical Mycologists. She is also the member of CPCB, MOEF, MOHFW, Expert Committee BMW Rules 2016, 18, and 2019. And she is the expert group member of WHO report, Global Analysis of Healthcare Waste in Context COVID 2022, Expert Committee member in National Infection Prevention Control Guidelines, Ministry of Health. Nationwide training she has conducted, and she has been the organizing secretary for more than 12 workshops of fungal infections. She has got 19 awards. She has a state award, Vidarbha, IAMM, Arvind Kurhare, and Rajaram Power, VAMM Guest Oration 2025, IAMM DC 2023, SC Talwar Best Publication, National and International, ISHAM Travel Award 2012, IAM DC 2012 Poster Award, SIHAM 2021 Best Poster Award. And with that introduction, I would like to invite Dr. Malini R. Kapoor, who is going to speak on laboratory stewardship, reducing waste, and HCWM rules. So I welcome Dr. Malini Kapoor to start with your presentation. Dr. Malini.
Thank you, Dr. Am I audible? Yeah.
Yes, please.
Dr. Harshvardhan Singh for the gracious introduction. And at the outset, I would like to thank CAPOOR, Dr. Aparna Jairan, Dr. Ravi Kumar, Dr. Ashok Ratan Sir, Dr. Vinita Kothari Madam, Dr. Mamta, Dr. Harshvardhan Singh for inviting me for this webinar on the pertinent topic, that is laboratory stewardship, reducing waste, and the healthcare waste management rules. We know that this issue is very important globally. It's an important public health problem. And Government of India is signatory to the Sustainable Developmental Goals and Waste Management, Sanitation, Hygiene. It's number 6. Yeah. So, and Government of India is also signatory to the Stockholm Convention, that is no open burning, that is no incineration, to decrease the dioxins and furans. So all the rules and guidelines what are coming up, that is to decrease the yellow category of waste. And of course, then also we have the principle of circular economy, so that nothing is left behind on earth. So these are the sustainable developmental goal. In the laboratory stewardship, I will be covering sustainable developmental goal number 6. Government of India is signatory along with other nations in the United Nations. And then of course, 7th is the affordable and clean energy. So whatever equipments, whatever energy we are using, we have to, save energy also, water also, minimize waste also. And then, of course, we also need to concentrate on sustainable developmental goal number 9, that is green infrastructure. So, I would bring to the notice of everybody, like in this month only, in India today, it has come that India is now the world's largest #1 plastic producer. And we have witnessed during COVID-19 times that if we do not have implementation of other rules, if we only implement biomedical waste, so the bulk of the waste gets 5 times. So if we do not have solid waste management rules or implementation of e-waste or the plastic waste management rules, then it can make your biomedical waste haywire, that stream haywire. And so when we think of waste, we need to minimize, or waste stewardship we need to apply in the laboratories, not only on biomedical waste, but also on plastic waste, e-waste, hazardous waste, solid waste, construction and demolition waste, the batteries. And we have a lot of automated equipment. So we have e-waste too, batteries too. And if you have in-house incinerator, then of course the fly ash also. And these are the various rules, like biomedical waste rules, solid waste rules, radioactive waste rules, hazardous chemical, and our labs have large number of hazardous chemicals. Then we have batteries also, then E-waste also, all the automated equipments have come under e-waste, that is basically extended producer responsibility. Then construction and demolition, like the labs undergo construction or demolition, so that also needs to be taken into account. And so what do you mean by lab stewardship in minimizing the waste? Clinical laboratories and the total testing process. Total testing process means right when the clinician writes the prescription, the test requisition, to the sample collection, then it is transported to the lab, and the various processes. They are major consumers of energy, water, and hazardous chemicals. And of course, they all generate biomedical waste also and other waste also. And so therefore, these clinical labs, whether it's microbiology, biochemistry, or pathology, or the smaller labs, like the endocrinology lab, hematology lab, or the other labs, they are major consumer of these, and they generate 5 to 10 times higher energy than that of office. And even your large and small electrical appliances like centrifuge or the smaller ones, Vortex and all that, and the bigger ones like the automated system or the analyzers, auto analyzers, the ACs or the water treatment plant or the vacuum systems or the exhaust fans, they all use energy, and they are important emitters of greenhouse gases, and they increase the carbon footprint. And of all these, if you look at the drugs or the antimicrobials, they have the largest carbon footprint. And then if you, the total testing process, that also needs evaluation under stewardship and sustainability. And processes in clinical lab and the total testing process, they go hand in hand. And so therefore we need to have more sustainable ways. I will not go into the laboratory efficiency, that Dr. Mamta Kankra will be covering. So what are the various strategies to achieve stewardship and sustainability to minimize waste? Like, we need to align globally also, like the WHO guidelines also, and modified as per our Indian scenario and the national guidelines also. And we need to have right at the inception, you have to plan a sustainable lab framework, designing a sustainable clinical lab at inception itself, prioritizing centralized laboratory facility, centralized specimen collection area, and then integrating testing zone, minimizing the distance between pre-analytical, analytical, and post-analytical, and judicious resource management pathways. You need to conserve the renewable energy sources, adopting sustainable lab products and purchase process also, and then embracing sustainable technological advances and promoting recycling, repair, reuse, reduce, and wherever we can of the equipment and the laboratory resources. Then we have, there are certain sustainable practices like optimum patient preparation, judicious test ordering, what is the right test, then best phlebotomy practices, preventing and controlling errors in all phases, and optimizing transport methods, preferring glass containers over plastic containers, which are reusable. Then we have, which can be autoclaved later and then reused. Then incorporating quality assurance program, adopting digitalization for test ordering, so that, paper generated is less, using automation for various lab processes, functionalizing integrated lab spaces, minimizing use of hazardous chemicals. Like the conventional PCR had a lot of hazardous dyes. Now we have moved to the real-time PCR. So they are less than promote decentralization by encouraging POCTs, and then you have interfacing equipment with, LIS and etc. Then using validated auto verification algorithms for reporting, and then you have capacity building training, establishing stewardship and sustainability office, developing stewardship and sustainability action plan, and targeting the certification under the ISO 14001-2015 standard, that is for environmental compliances, then implementation of sustainability service, quality improvement, and identifying stewardship and sustainability ambassadors, training lab staff, clinicians, stakeholders, administrators, even your postgraduates, like what exactly is waste minimization right at the UG level also. And then ultimately we have, point on dot, that is sustainable and stewardship practices, that is for biomedical waste management, segregation at source, adherence to the local rules and guidelines, good autoclave practices, comprehensible cycling programs, means at the level of common facility operator, that is State Pollution Control Board certified recyclers, then align with the global and the national guidelines. Global, we are all aware, then more than 70 countries are signatory to the Sustainable Developmental Goals, and to achieve them by 2030. And waste management is Sustainable Developmental Goal number 6. Then you have renewable energy, another Sustainable Developmental Goal, infrastructure, green infrastructure, that is again another. And so these good practices, they minimize the energy, they conserve water, minimize waste, and they minimize the use of hazardous chemicals also. There are so many international, organizations, and so many like European Union Eco-Management Audit Scheme. But most important at this level is that we have the national guidelines on the waste minimization, waste management, not only of biomedical waste, but also of other waste. And these are also incorporated in other, the MOHFW infection prevention control guidelines. And there are so many chapters on that, but ultimately we have to follow the Gazette notifications and all. So design a sustainable clinical lab at the inception itself. So the core lab should have minimum multiple judicious use of instruments, then need to have water harvesting plants, specimen containers, and then, like ISO 14000, heating, ventilation, AC, that is HVAC system using renewable and increasing the energy efficiency, high performance window system. Then you have, the fume hoods, and then emitting the LED lighting, then heat blocking, window film is there, then installing the sensor lights, and equipment need to have the lower energy consumption and have the sustainable purchase policies. And wherever, like in the small equipment, you can have extended producer responsibility like Vortex or smaller ones, so that the manufacturer only takes back the equipment. So conserve the renewable energy sources. Water, you need to fix the leaky faucets, the gray water recovery. We often talk of the reuse of ETP, STP water. After treatment, they can be used for horticulture, and they can also be used for the flushing system. But my concern is, like, are we meeting the norms? Then only reuse the gray water coming out of ETP treated. Gray water coming out of ETP and STP, don't use it for even flushing if you do not comply to the norms. And then water saver fixtures are there. Then you have water saving devices are also available. Then instead of autoclaves, with the water aspirators, you need to have vacuum pump in then, and then selecting equipment that uses less amount of water. Then water purification plant. Type and size of water plant is also very important. And then the reverse osmosis plant, it rejects, 50 to 80% of feed water. So you need to minimize that, have the energy efficient practices, and have the frequent and periodic cleaning and defrosting of the freezers to make space for better cooling in your lab. Then you have, of course, there are cleaning products available, but there are eco-friendly green cleaning products are also available, which are non-corrosive and non-toxic. And then minimize the hazardous heavy metals or the hydrofluoric acid. And then you have mercury in the thermometer now. But of course, the hospitals have switched from, the mercury thermometers to the digital thermometer. But what about the labs? Your fluorescent microscope has got a mercury bulb. There is no, I think, replacement for that. And then adopt the sustainable laboratory products and purchase process, and buy equipment with best ethical and environmental practices, and keep the buyback policy, whether it's your automated equipment or the biosafety hood, under the extended producer responsibility. It is there in MRI and CT scan machines, but best is to have in your, so at the time of tender itself, have an extended producer responsibility. And in cases of the chemicals or the hazardous chemical, it's better to have the material safety data sheet. In the tender itself, you write the supplier to supply the material safety data sheets and the neutralizers along with your hazardous chemicals and the other chemicals. Then embrace sustainable technological advancement, use telelaboratory services, and use the online data storage, and so without compromising on the quality and the patient safety. And promote recycling, repair, reuse, reduce, and there is, refurbishing of equipment. If you have a chain of labs, for example, and if your central lab is the biggest lab, you can give your refurbished equipment with under the quality standards to the peripheral labs. And you can also have the reagent sharing programs to decrease the laboratory carbon footprint, reducing and refusing the use of single-use plastics or SUPs. And then, you can have statistics on how much of plastic your lab is producing. And then the solvent recovery programs are also there. There are certain solvent recyclers are also available of the hazardous chemicals, xylene, formalin. Delhi has a TSDF, that is a hazardous facility, which, like what you have, like the common facility operator has an MOU with the particular hospital. But now, since it's a laboratory, you have a lab, so your lab can have, especially the pathology lab, can have an MOU with the TSDF. That's a hazardous facility. This is now Government of India is opening like in the periphery of the major metros. So Delhi has recently, a year back or so, the TSDF has become functional. You can have MOUs because certain neutralizers are not available for certain hazardous chemicals. So there you can have MOU and the take back program, or you can have the manufacturer take back programs also. And then reusing of the packaging material. Sometimes if your supply of blue cardboard boxes, what you use for the disposal of the glasswares, if they are not available, you can use, you can use the cardboard boxes also, and with the biohazard label and with the blue marking. And then electronic or CD versions of the catalogs can also be used to reduce the paper use and other thing. And then of course, for used paper, you can have separate bins so that you can use them. And in Safdarjung Hospital, we have recycle melas also, where we give in our e-waste and get as a part of barter the recycled paper and the recycled cloth bags also. We have these recycle mela often. And then sustainable total testing process, how it should be done. So at the outset, in the pre-analytical phase, judicious test ordering by best phlebotomy practices, optimum transport methods, optimum transport duration. And then in the analytical, we have the integrated testing zones, optimum specimen processing, and reuse and recycling of water and solvents and fixatives. Like again, that hazardous facility, you can take thing, they reclaim that solvent, they reclaim that fixative. Then in the post-analytical, you have validated auto-verification algorithms are there, telelaboratory practices are there. And then we have, of course, you have a devoted internal and external quality assurance program. And so to decrease the recollection, retesting, and have the laboratory automation also. Then, of course, POC team, they are like double-edged sword. Like if they reduce the hospital visit, if they are done at the point of care, but in the peripheral areas, they decrease the laboratory visit, but again, they generate a lot of plastics. They have basically thermoplastic and elastomers, which are an environmental burden. But again, now government is coming up with, strict, the environment-friendly plastic norms for them also. But again, we have a long way to go. And then if you're a bigger organization, if you're a chain of lab, have a sustainability stewardship office, issue the green research newsletter, green research events on the environment day, and then this ISO 14001 is 2015 standard for environmental management. And then you have awards for sustainability or stewardship, laboratory stewardship ambassadors, and ultimately it's teamwork for all. And for the waste minimization, waste stewardship, you need to have waste segregation at source. And then of all the medical waste composition, 60% is attributed due to blood collection, then 5 to 20% by gloves. Then, of course, we have the single-use plastics also. But luckily, Government of India has, all the roads across India, they need to have 2 to 5% of plastic use to strengthen the roads, to make them impervious to water. And so, therefore, this kind of plastic, which cannot be recycled from the biomedical waste stream and from the general solid waste stream, goes in for road making. And India is pioneering in that technology. So meticulous waste segregation and ban the use of chlorinated plastic bags. We are using non-chlorinated plastic bags. So what is the implication of the plastic waste management rules? You need to have 75 micron non-chlorinated biomedical waste disposal bag. And then single-use plastics we have for specimen collection, transport, allocating. Again, if they cannot be recycled into bench making and other devices, they are used for road making by the authorized recyclers. Mind that as per the mandate of biomedical waste rules, the authorized recycling by the State Pollution Control Board authorized recyclers is being done at the common facility level, not at the hospital level, unless you have a in-house incinerator. Then you have to do especially in the Northeast, where the common facility or the captive facilities are not available. There you can do, but otherwise most of the labs, they are linked with the common facility operator. So the recycling is done at the common facility level. And then you can have the recycling programs for the non-hazardous waste. In Sabdajan, we have, like once in 3 months, we have barter system. We exchange our, the paper, the non-confidential paper for the recycled paper and etc. And then corrosive liquids used in the labs should be neutralized before pouring them in drains. I will be covering this topic later in my later part of speech. And reducing lab waste with smarter packaging to decrease the environment footprint. You need to have eco-friendly packaging, recyclable cardboard that you can use often. Then of course, the fume hoods, they need to have the LED lighting and then take back programs. That is again under extended producer responsibility. This picture I want to highlight. Now, see, whenever you are having the recycling of your gray water, mind that please check their BOD, COD, and BOD, COD, the total solid, the heavy metals and all, and then only use it for the flushing or for the horticulture. Otherwise, please don't use this. Most of the times they are not meeting the norms. So be very careful in that. So I wanted to highlight that. And this is an important article on revisiting the environmental impact of inappropriate clinical lab testings. I just wanted to show this, like how many of our lab tests, they say that 1 out of 3 lab tests are considered inappropriate. So you can see the quantum of waste these labs are generating. So see the test, if you can convince the clinician, like, is it judicious, appropriate or not? So you can have that in stewardship. And so a lab prescription, that is the test prescription, can be appropriate when it meets the paradigm of 6 hours, right test by the right method, and right time on the right patients, having a right outcome. And of course, but when patient care cost, you see, like it has to be the right test. The cost will come later. Of course, the affordability is also a problem. Then what is the impact of inappropriate lab prescription? So it has, 3 P's, inappropriate. You have, one is economic impact, one is environmental impact, and then is the human or the medical impact. like, all three, it is burdening. And so you have, like, if you are having over, test in an already anemic patient, the borderline anemic patient will land up in anemia. And then again, you may land up, if you're having overuse of these tests, the incidental findings are reported, the patient stress and discomfort is there, the staff workload is there, additional examinations are done, and that will increase the stay, delay the diagnosis. So it's basically a vicious cycle. And then you can also have misdiagnosis. So many, I mean, so they have, this is the human or the medical impact. And what is the economic impact of an inappropriate, apart from increasing the biomedical waste, it can increase the cost, hospital stay, machine investment, energy consumption, labor cost, and so many are there. Then, of course, the environmental impact, it increases the carbon emissions, increases the generation of waste, increases the, the water consumption. And so how can we promote better prescription in laboratory? By education, of course, if you have in the stewardship program, what is the right test, what is to be done, that is the diagnostic stewardship. If you have, then guidances, there are a lot of international guidances, but the need of the hour is to modify as per the national need and the hospital or the, that need. Then audit and feedback, then the computerized physician order entry is also very important. Gatekeeping is to checking. And then you can take the use of AI, that is AI and machine learning. And then these interventions are not all equally frequent and are effective in various proportions, like sometimes the feasibility is not there, efficacy on test reduction, then persistence over time, cost effectiveness also you have to see in all these strategies. So we need to have better guidelines. You need to modify the international guidelines as per your hospital or labs, as per the patient. Then small volume tubes, if you can use, you can take help of the artificial intelligence and machine learning. And then there is a decision support platform for the prescribers. So that was about, the generation, how these the laboratories generate waste, but what kind of waste and what all needs to be implemented. So solid waste is the general solid waste. So if you have a lab, mind that you needn't have a composter. The hospitals can have composter if the hospital size is more than 5,000 square meter, but at least have, if you're a lab, implementation of the solid waste management rules. And that is, green is for biodegradable and blue is for non-biodegradable, like that is for recycling. And this is our composter. Of course, we are a huge hospital. Then, so we have so many 6-7 kitchens. We are more than 3,000 bed hospital. It's NABH also, NABL also. It's got under Kayakalp also. We have a material recovery facility. But if you are a small lab, just avoid that. If you're a big hospital, like, Gangaram Hospital or Max Saket, the branch, or Apollo in the private, All India Institute of Medical Sciences, you can have material recovery facility for the solid waste. We categorize the plastics and then give it to the authorized recycler. This is non-biomedical waste. This is general solid waste. And hazardous chemicals are there. So if you are a lab with a radiology facility with it, there are so many labs with radiological facilities in that. So the lead aprons, goggles, the lead shields, they need to be given to the lead recyclers, again authorized by the State Pollution Control Board. And if your State Pollution Control Board, for example, the Delhi State Pollution Control Board doesn't have the authorized recycler, then you could take help of the neighboring state like UP or Haryana. So similarly, if Kerala doesn't have it, they can take from Tamil Nadu and the other neighboring states. And then radioactive waste rules. Luckily, like 25 years back, the automated equipments, they were instead of the Bactylord bottles, you had the radiometric automated methods, and their disposal was difficult. So the radioactive waste rules were applied to that. But luckily now we have, in the automated blood culture system, we had colorimetric system, Bactelot, and even BD is using non-radiometric methods. So the implementation of radioactive waste rules is not applicable. But yes, if you have with your lab, you have a radiology facility or you have a PET scan, then again you have, or some technetium scanning. So you have these rules need to be EAERB certified, and it is basically, the bottom line is 10 times the half-life of that particular radioisotope you have to keep in an isolation room, and you need to have fume hood, which we have shown. And then after 10 times the half-life of that particular radioisotope is over, then it is to be treated as biomedical waste. These are the lead bricks. The sharp container is also surrounded by the lead bricks. So these are for the labs which have, the radiological facilities or the PET scanning is there. So then these are implemented. Then e-waste rules. E-waste rules got notified in 2024, and in 23 also there was an amendment, and they are basically extended producer responsibility, return back. So all these automated equipments, whether you are having auto analyzers, or the radiology centers have got MRI, CT scan, or ultrasound, they are covered under extended producer responsibility or buyback. But now, like, our hospital has implemented this e-waste rules. So you need to file the annual report like the biomedical waste, and you need to have an MOU with the government state pollution control board authorized recycler. Then plastic waste management rule. Whatever conference you organize, lessen the plastics, decrease the use of plastic, whether it's plates, cups, or the banners, spoons. And what is the important implementation for the labs? The biomedical waste disposal bags, instead of 50 microns, will be 75 microns and upgraded further to 120 microns. Hazards, we are all aware of the hazards of unsafe biomedical waste management, litigations, PIL, punishment. But, of course, the antimicrobial resistance, they are reported, the residues are reported in wastewater, groundwater, and no effluent treatment plant is able to detect them. So this is a lacuna in the rule. And then all the major Indian rivers have these residues, and also the active pharmaceutical ingredient. And the cancer incidence has also risen, like 79% increase in the last 30 years. And again, the environment and waste is to be blamed as the fourth reason. And these are your effluent treatment plant. But if you are a standalone lab, then effluent treatment plant is not recommended. But if you are a large volume lab, generating specific, it's mentioned, then you need to have, like, if you have the main center of a reputed chain of labs, then that need, because you are generating a lot of biomedical waste, which needs pre-treatment. And of course, you're doing pre-treatment with the lab samples in the form of autoclaving or by the sodium hypochlorite. But again, the standalone labs, they won't be having ETP, STP plant. Okay, then you need to have environment monitoring group if you're a big center who takes care of these, the rainwater harvesting or the DG sets which are used in your lab. And do you have a green certification or not? And biomedical waste rules, I think 16, then their amendments, everybody knows of. They are the guidelines which are available, and COVID-19 waste or any virus which is not category A, means it is not a hemorrhagic category virus, it is to be treated like any other biomedical waste. And these all rules and guidelines, they always focus on decrease in the yellow category waste. And then you have a common facility operator which collects the biomedical waste, and no biomedical waste should be kept beyond 48 hours in your laboratory. And again, non-chlorinated PVC-free bags, everybody knows about it. You need to have an MOU and then the contract with the common facility operator for the occupational safety. All your laboratory technician, the waste handlers, they need to be immunized by 2 vaccine, hepatitis B virus and tetanus, and go beyond the rules. Check their titers. If they are less than 10 international unit, revaccinate them. If there's a pandemic, luckily India stopped at 29 cases of monkeypox, have the relevant vaccination also. Trainings are very, very important. Monitoring is important. And then instead of generating a lot of paper, you can have, these apps customized to your labs or departments. You need to post your data of your lab on the website of your laboratory. Annual report needs to be fine. Monitoring of records. Then barcoding is recommended. Pre-treatment of lab waste. Then for the yellow category, it's the infected waste, that is human anatomical, anatomical. Then the paraffin tissue, which is, the blocks, they will be going in yellow. Then, of course, you have the chemical expired drugs. Then ethidium bromide, conventional PCR were using this hazardous chemical. So 5 ppm is drain safe, but if it is more than 5 ppm, treated as cytotoxic waste, you could, double bag it and put it in the cytotoxic waste C label for high degree incineration. All these kind of PPE will go in yellow category. Then microbiology waste, the laboratory waste, there's a huge shift in that. After autoclaving will go in its respective category. If it is plastic, that will go in red. If it is glass, it will go in blue category. So effluents, please ask for the material safety data sheets of all the chemicals which you're using, whether hazardous or non-hazardous. Ask for the neutralizers in their tender itself. Like formaldehyde, glycine is the neutralizer, glutaraldehyde, sodium. Then you have, of course, drain disposal. Certain chemicals are sewer acceptable, certain are not. So keep in mind that. And the pH of the effluent should be environmentally sound. That should be 5.5 and 9.5. If you can test that and neutralize within, like for example, ascorbic acid is a good acid. It's an edible acid that you can use for neutralizing if your pH is beyond 9.5. Then, of course, yellow is for the soiled waste. Red is for the infected plastics, and this all will go, whether it's catheter or the PPs of this material will go in red category, barring the shoe covers, which is of thin non-recyclable plastics, non-recyclable. That's why in yellow, that shoe cover. So laboratory waste, everything needs pre-treatment. See, if it is not a broth of culture, you can pre-treat it with sodium hypochlorite, which I have enlisted. And then what goes for autoclaving? It's the culture plate with the organism. It's the broth with the organism. The blood bags will go for autoclaving. But blood bags after autoclaving go in yellow category. But these culture plates, which are made up of plastics, and these automated blood culture bottles, which are made up of plastic, after autoclaving will go in red category as they are plastic. Then white is for sharps, and then of course glass will have glass vials, and monkeypox waste is like any other biomedical waste, so no separate handling. And so reuse of treated sewage, this is very, very important. Please follow the norms and then only reuse the gray water coming out of your ETP STP. This is a TSDF, that is a hazardous waste facility in Bhavana, the outskirts of Delhi, where you can have an MOU for all your hazardous chemicals, what you're using in the lab. Xylene, if you don't have, you can have an MOU and send it there. Then this is, the report of National Green Tribunal, which it says that around the laboratory, standalone lab, or around the hospital also, you need to take care of 200 meters, you need to take care of the general solid waste. Nothing should be pilfered or nothing should be scattered along, littered along, and not only biomedical waste, but the other waste also. And then this is the WHO site for waste management, wherein you can track the waste. The country-wise data is there. Luckily, India, if you see, it's better represented here. The rules are there. biomedical waste is 80 to 90% implementation, rest are on the way. So the need of the hour is not only biomedical waste, but all equally important is the other waste. So the technologies which WHO recommends is the steam-based technology, that is autoclave, and again, decrease the burning, like decrease in the yellow category waste, which goes for incineration. Then these are the sites. So to conclude, laboratory stewardship is a multifaceted approach encompassing, designing the lab, sustainability at the inception of the, when you're building up the lab, then incorporation of the technological advancement, judicious resource management, and of course, the staff training is equally important, and taking measures to reduce and prevent the errors in the TTP and green lab spaces and process that together can make the positive impact on the environment. So it's basically waste management, waste minimization. They are based on the principle of circular economy, that nothing is left on earth. Like, for example, only the yellow category goes for incineration, rest all, whether it's red, infected plastics, or the glass, that is blue, or the sharps, that is white category, after treatment at the common facility and few at the lab level, it is being given to the authorized State Pollution Control Board authorized recyclers. So you have done urgent intervention in terms of system capacity as far as the biomedical waste management rules are concerned, but the need of the hour is implementation of other rules, because biomedical waste is just 25 to 30%. Post-COVID, there's an increase. Earlier, it was 20%. With increased use of PP is quite 25 to 30%. But implementation of the other rules, whether it's the e-waste or the general solid waste, is equally important. And then best is to have, combination of instruments, small instruments, small equipments, return back to the manufacturer. Then e-waste, all your automated equipments, extended producer responsibility. Gray areas, yes, they would be there, because we have multitude of, consumables coming up. Whatever is not documented in rules, follow the international guidances. And of course, the common facility operators are not enough in number, but even if they are enough, what is the need of the hour is the third party audits. You have given your, hazardous chemicals to the TSDF, like xylene and etc., or the mercury you have given, but what about their audits? Are they disposing it off properly? And then, of course, the ultimate aim is green and clean hospitals and lab under Swachh Bharat, and as per WHO, roadmap to One Health, so that we can achieve the United Nations Sustainable Development Goals by 2030. Thank you. So waste stewardship, sustainability, and waste management is, again, it's responsibility of all the stakeholders, like whether you're inside the lab, outside the lab, that is clinicians, and whether it's the other healthcare workers, administrators, the pollution control board authorities, the manufacturers of the lab equipment, the manufacturers of the lab reagent, the National Green Tribunal, the Central Pollution Control Board, and we need to have the inter-ministerial coordination between Ministry of Health, Ministry of Environment, and other ministries also. So thank you. It's basically a teamwork of all stakeholders. Thank you. Any questions? I would.
Thank you very much, Dr. Malini, for touching upon very important area, and you have taken us beyond, biomedical waste. That's why you have taken a topic on healthcare waste management rules. So you have really touched it very nicely. I think all participants must have been benefited by that. And we will take questions after the session of Dr. Mamta. So I will request you to stay back.
Sure, Dr. Harshman. Pleasure.
Thank you.